Hi, my name is Casey Nicolich at Rise with ABA, and today we're going to talk about preference assessments. A preference assessment will help the therapist identify what their client is currently motivated for. There are many different kinds of preference assessments. Some of our clients already know what they want, so we can simply ask, "What do you want?" and they'll tell us their preferred item. Other clients may not be so sure, so we can offer them what is called a free operant preference assessment, and we can take them to a room of toys as such and ask them, "Pick a toy." Maybe your client finds the free operant preference assessment a little too overwhelming. There's just so many choices. So we can also recognize the toys that they play with alone or that they are drawn to if I'm playing alone, and we can offer it to them. This is called a single item preference assessment. Sometimes the client is better suited to a paired stimulus preference assessment. This is similar to the single stimulus preference assessment, except the item or the stimuli is presented in pair with a highly preferred item. There are two more types of preference assessments. These are multiple stimuli preference assessments. These can be used by a BCBA for a lot of different reasons dependent upon the client's needs. In these types of preference assessments, you'll set out multiple stimuli and the client will choose what they want. And one of them, it will be a with replacement. So if they choose this item, after they have chosen that item, you will put it back and ask them again. And the other type of multiple stimuli preference assessment, when the client chooses the stimuli, it does not return back into the line and they are asked once again which they prefer. Let's review our options for preference assessment that we talked about today. The first three were a free operant preference assessment, a single stimuli preference assessment, and a paired stimuli preference assessment. And the last two preference assessments are the multiple stimuli preference assessments, without replacement and with replacement. And these are the kinds of preference assessments most commonly used in ABA therapy. Thank you for watching.